So this will be for still technique for an extended type 2 somatic dysfunction. Just a note on the lower extremity motion, what you're going to use is you're going to use the lower extremity in its motions in order to induce motion at the lumbars. A deduction of the lower extremity will induce rotation away from us at the lumbars. A abduction will induce rotation towards us. Internal rotation will drive the innominate superiorly to induce ipsilateral side bending, and external rotation of the femur will induce innominate on that side driving inferiorly, which will induce contralateral side bending in the lumbars. So if our patient has an L3 extended, rotated, and side bent right lesion, we're going to be somatic dysfunction, we're going to be standing on the right side of the patient. We're going to put our monitoring hand at the transverse process of L3. We're going to flex the knee and hip up until we feel motion at the level below. So my middle finger is on L3 and my ring finger and pinky are on the level below, so I can monitor what's happening at both segments. So as I bring her up into flexion, I will feel motion at L4, and I should feel L3 relax as it relatively extends. Then I'm going to bring the knee towards me and bring the leg into abduction, which is going to rotate the lumbars to the right. And I'm trying to do this at L3, which is the segment I'm trying to treat. Then what I'm going to do is I'm going to add a little bit of internal rotation of the leg, which will induce that ipsilateral side bending, again, at the L3 segment. Then once I feel that I'm in its maximal position of ease, I'm going to add my compression from the knee down into the acetabulum, pelvis, and up into the lumbars, and I should feel that compressive motion happening in my monitoring hand at L3. Once I have enough compression, I'm then going to maintain that compression as I bring her leg through an arc in adduction, external rotation, and ultimately down into extension onto the table, bringing that L3 segment through its restrictive barrier. And then I will recheck.